Hi, everyone, and welcome to this week's episode of Fitness Knocking with Lois. I'm your host, and we today are talking about age again. And when it comes down to age and how we feel about ourselves, it often interconnects to how we're moving or if we're moving well. So today we have an amazing guest with us on again, my good friend, Efi Cohen. Efi, how are you today?
Hi, everyone. Doing well, thank you. Enjoying the sun peeking through the clouds.
Yeah. I thought it was supposed to rain, but I'm glad that it's not. So today, so those of you that are watching me for the first time today, if you're watching me from Efi's channel, I'm Lois and I own Fitness Knocking. We're a mobile personal training service. So if you know someone who's having trouble right now with getting their exercise in, have them give me a call and we'll be able to help. But those of you that haven't met Efi before, Efi is a physical therapist and we do a few different things together. And I think that it's really important to be friendly with all of the people that are working together on your health. And one of the things I hear all the time is, I feel old because I'm creaky, or my joints hurt, or my back hurts, or this hurts, or that hurts, right? Efi, do you feel that like that all the time? You hear that all the time?
Yes, that's usually the number one. If something doesn't feel right, I'm old, man. I'm old. I'm getting old. I'm like, no, well, not necessarily.
Yeah. So Efi is going to help answer a bunch of questions today. So if you could comment, like, subscribe if you're watching this on YouTube or after the fact. If you have any questions as we're going along, please drop them in the chat. We're happy to help as we go along today. So people always say they think they're old because they have pain. So let's talk about pain for a second. We've had this conversation many times and different thought processes behind pain. So Efi is going about it from a physical therapist perspective, and I'm going about it from an exercise expert perspective, and it should be different. Would you agree with that?
Absolutely.
Yeah.
Yeah.
So tell me, in your opinion, what kinds of pain there are.
Well, it's okay to experience pain. That means you're feeling. It's better as opposed to not feeling anything. And then the question is, what kind of pain is it? So people's immediate reaction, I'm in pain. Somebody has to do something for me to get rid of this pain. That's usually the number one preferred method, is just give me something, run to the doctor, just give me something, do something. Somebody else just do something.
Right.
As opposed to saying, wait, I have pain. How did I get here? Like what is causing me pain? And that process, let's think about how I started getting pain. And for most people, that's a big step, whether they're working with the personal trainer or the physical therapist. And you have to acknowledge that you're experiencing pain and then figure out what kinds of pain there are. So there is pain out there that, if a bee stung me, or if I have a splinter and that caused a pain, that's one kind of pain, like an injury pain. You sprain your ankle, an actual injury, you have an injury pain. Then there's like smaller scale pain, like I keep using my body in the same way, and there's that wear and tear. So there's that wear and tear as opposed to an acute injury, then there's the wear and tear. And then there's pain in the body that's stored there, and it's connected to your emotions or a memory, or you're under a lot of stress. And when you're under a lot of stress, your body assumes different positions, and they sort of get stuck there because you're kind of like bracing yourself. You're bracing yourself in anticipation or fear, or just I have so much to do, and the load keeps lowering you down. And so your body goes in sort of this like locked position or a flex position, sort of slouch position. And it's all stored in there because you're clenching so much, you're creating pain. And so there are different types of pains that are out there, and depending which healthcare professional or professional you're working with, there are going to be different types of pain. And different people address different kinds of pain. And so things that you're feeling in your head, we use a psychologist, social worker, psychotherapist. And then when we sort of feel kind of achy, I need to exercise more. So we go to our personal trainer to help us get into a good routine of exercise. And all of us need that motivation to exercise. It's not so easy. There are very few people that say, yes, let's go exercise. Let's do this type of exercise. So it's good to consult with a professional, sort of guide you with the correct exercises. Right. But then you have these other pains, it's always my back, always my back. And the initial run sometimes is to go to a physician, but you also could run to physical therapist. And when you're with that physical therapist, they're going to take the time to figure out where exactly it's coming from. So sometimes it's a wear and tear, and sometimes it's some other system in your body that's what we call referred pain. So sometimes you think your pain is coming from that exact location where you're experiencing it, and sometimes it's not coming from there at all. It could be participating in this sort of how you're using your body, but it's coming from somewhere else. So we take the time to figure out, where's that pain coming from? What kind of pain do you have? And so we all look at pain from different perspectives, but we all must appreciate that pain because it's telling us something. And so sharing that with that professional is, I'm having pain.
Yeah.
You need to share it.
I think that's a great point there is expressing, hey, I have pain here. And in my opinion, as an exercise professional, I don't push to pain. As a physical therapist, you're trained to push to pain. We, as exercise professionals, try to avoid pain because, frankly, if somebody feels hurt or in pain when they're exercising, especially the day after they exercise, they're not going to want to do it again. Mm-hmm. So how do you know as a physical therapist to, how do you know if you're not a physical therapist, if you're just a regular patient or person having pain, how do they know when to come in to see someone like you?
So I think that's an excellent question. I think when you don't know what's the good pain versus the bad pain. So If you just keep experiencing pain, I would say go to the PT. They'll explain to you what's the good pain, what's the bad pain, because there are things that we do when we treat, it will cause a pain, and we explain to our patients, clients, you're going to experience pain. That what we did, this type of release to either your joint or your muscle, you will feel soreness, pain, because remember, pain, the different descriptors of pain. And so we try to qualify them. Do you feel like it's stabbing? Do you feel like it's an ache? And getting an appreciation of, yes, we just did this type of thing. You're going to feel some soreness or pain for 24 to 48 hours. If it exceeds that, something else is going on. And as you learn to exercise, the same phenomenon is going to happen. You're going to have is this just I've used muscles and they're working really hard? Or no, something just does not feel right.
All right. Very cool. Very cool. So in your opinion, I mean, I have my opinions on this and I'll share mine after you share yours. But how do you know from your perspective? Now, again, you're talking from the physical therapy perspective. I'll talk about from the exercise perspective. But in your opinion, how do you know, if a patient or a client of yours is working too hard?
So we look at our vital signs. We want to make sure you're checking your blood pressure, your heart rate, get comfortable using it. Nowadays, it's so easy to get a good portable machine, so you get used to it for yourself, how you feel. How do you feel when they're taking that measurement and it's higher than your normal? So we take our vitals, very important. And also exercise should be a gradual increase. If you feel like you're pushing yourself too much because for whatever reason, you're not ready for it, you're nervous, it's a new experience for you, share that with your trainer so that they know this is too much, or even your therapist, whoever you're working out with or working with, this is too much, I need a little bit less, and it's okay. You really can gain a lot from a little bit of exercise or a little bit of treatment.
Yeah. So I avoid the word pain altogether when I'm talking to clients. So if a client tells me they're in pain, to me, that's a red light. If you're driving a car and you see a red traffic light, what do?
Stop.
Yeah, absolutely. So to me, pain equals red light. And as an exercise professional, I want to make sure that somebody feels good the next day and they're not super sore. So that's a red light. And if somebody has a lot of ailments, that's also another reason to avoid red light. Now, granted, if you're a professional athlete or something like that, then yeah, I think pushing that envelope to get to the next level, sure, absolutely. But from majority of population, I think that from my perspective, avoiding red lights is a good thing. And then even yellow lights. So when we're driving a car and we see a yellow light, slowing down, it's the body's recognition of, hey, this is too much. I'm overworking here, but we want to feel green light. Like when we're driving a car, we would proceed with caution. You want to feel a little bit of discomfort. And I say discomfort is good and warmness is good. But once it gets to severe burning, that's almost too much. So what are your thoughts on my method?
I agree. I think you can experience a little bit. I agree that you should proceed with caution. And if you have that, stop what you're doing. You may just need either a modification or a change to the exercise that you're doing. So maybe your whole body's not ready for that particular exercise. So maybe you'll do something that uses different parts, a little less intense. But yes, it's okay to say, hey, something does not feel right. And it's okay for us who are working with you to say, okay, let's try it this way. And it may be an easier way for you to do something, and that's okay.
Right. And listen, I think that's another great tool there is listening, paying attention to what your body is saying. If you feel a whisper, a little tweak, or ouch, that doesn't feel good, listen to that. Pay attention to it. Communicate that with your trainer or with your physical therapist so that they can either adjust or let you know, hey, that's okay. Keep on going. You're good. But that's wonderful. So tell us a little bit about what you do with your patients or the clients that you see. I know you work in a lot of different types of offices and help people with their posture, which is a lot of the times attributed to back pain, right?
Yes. So most common back and neck pain. So usually if they're seeing me as a physical therapist, they're coming to me because they have a problem.
Right.
And the pain that they're experiencing, we have to, anytime someone experiences pain or discomfort, we have to assess how they're using their body. So of course we go to the areas and figure out where it's coming from, but also to learn how you are using your body, because sometimes you just don't realize how you use your body. You get so engrossed with your activity at hand, whether you're at work, whether you're at home, whether you're enjoying your sport, you just don't realize that how you're using your body is causing your symptom because you're not using it in the best way possible. So first you learn how you've been using your body, and then you learn how to better use your body. And that process requires, of course, exercise and modifications, and it requires skilled therapy. And then outside of it, you may need to be more active, and how to be more active and to strengthen those muscle groups. And so that's why there'll be time that you're going to be working with a physical therapist. And then we call it like a graduation and say, you worked well with me now, and now you're going to go with your personal trainer to work on an exercise program. And if for some reason there is discomfort when you're with your personal trainer, you'll be back and you work together, and together you grow that program so that you can exercise and have a healthy lifestyle.
Right. And communicating that. I think that's really important if you're working with a PT or you're working with an exercise professional, or even if you're working on your own, to communicate with them again and have that ongoing dialogue of saying, okay, if you don't understand something, ask questions. It's okay to ask questions. And a lot of the things that we take for granted, being in the industry, we forget that sometimes people don't know or haven't heard it before. So I think that's really good advice. So we have a couple of comments, really interesting. Hi, everybody. Thank you for watching. If you have any questions, you want to drop them into the chat. Efi right here, I'm sure would be happy to answer them for you. I had somebody text in from YouTube. Back pain could be attributed to a lot of things. I feel this person asked me that they feel pain in the middle of their butt. What could that potentially be? Could that be like piriformis, or I guess it would depend on where it is, right?
So do you mean the tailbone when you're talking about the middle of the butt? Because you know that there's a separation between your two cheeks. So when you talk about the middle of the butt, it could be the sit bone. And so they could be sitting, it's how they're sitting in their chair. Remember, now that people are working from home, or everything is from home, and your online shopping is from home, a lot of people are sitting for long periods of time, but it's how they're sitting. And it could be for them, they need to learn how to sit, not on that spot.
10 hours a day they're sitting.
Yes.
Okay.
A lot. Yes. So for that particular person, it's probably how they're sitting.
Right.
And what they're sitting on, and they may need a just different type of seat that they're sitting on, how they're sitting. But it's an excellent question because they're not the only person who's having pain sitting on their bottom.
Right, right. I would probably suggest to change up how you're sitting also, but also change up how you're working. So if you can, I mean, I'm a big fan of net walking or like meeting walking. So instead of taking a Zoom call, I try to take some of my business calls on the phone so I can walk around my office and get up. And I also put I call it buffer time in between my appointments to give myself a little bit of time to stand up, go get a drink of water, walk through my house, to go up and down a couple flights of stairs. All of those extra steps throughout the day will help to get the blood flow again and hopefully to alleviate some of that for sure.
Yeah, some of it comes from being in the same position for a long period of time. But it's also how you sit on every surface, and you just don't realize how you're sitting.
Yeah, yeah. And if you're really not sure, I mean, having a professional look at your body position, because sometimes what you think you're doing and what you're actually doing are two different things.
Yeah.
A picture is worth 1,000 words. So have someone take a picture of you sitting sideways and you'll see in a relaxed position, oh, wow, that's why I have pain. So.
Yes.
All right. Well, Efi, thank you so much for coming on to meet with me.
Absolutely.
Those of you that are watching from home, thanks again. And thanks for the question. I really appreciate that. That person that's watching on YouTube. And the rest of you, have a great rest of your day. Oh, we have one more question that just popped up. We'll try to answer pretty fast. Hey, Chloe, my hamstrings get pretty sore pretty easily. What's a good way to prevent this besides your typical hamstring stretches?
Sure. Chloe, is it happening when you're sitting or when you're standing and walking around? Because it's going to be different for different reasons. So some people get it because how they sit for long periods of time, those hamstrings get really tight and then they end up being sore when you have to stand up and get moving around. And some people are having it while they are walking around, how they're using their body and standing and walking. It's an excellent question, Chloe, and it probably needs a little bit more further investigation than our just a 1-minute question here live, but I'll be more than happy to have a discussion with you. It could be from various different things why those hamstrings are always sore. Good question.
Great question. Let's see if she said both. She said both.
Yes. So Chloe, you may need some intervention.
Yeah, definitely look into that. Efi's a great resource, and she works virtually, right, Efi?
I do. Yes, I do. Yep, absolutely.
All right. Well, Efi, thank you so much for your time today. Those of you that are watching, thanks for joining us today. And you all have a wonderful rest of your day. Thanks for watching, and I'll talk to you guys later. See you.
Take care, everybody.
Thanks.